Hello, and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, on Facebook, and Instagram. I'm your host, Kimberley Cartwright. I'm the News and Public Affairs Director here at WNCU, and we're using the Zoom platform, as always, to talk about how COVID-19 is affecting our world. May is Mental Health Awareness Month, and during this month, Dr. Michelle Cotton-Laws, Chief Experience Officer for the North Carolina Medical Society, has committed to talking to us about mental health issues to help us cope with COVID-19 stressors. And today we're going to talk about how young Black and Brown kids are working through COVID issues. We know that Black and Latinx children have witnessed more illness and death during the pandemic than any other kids. And the question today is, what can be done to help with the situation? Hello, Dr. Laws, and welcome back. Always a friend of WNCU.
Oh, it's always a pleasure, and I'm always honored when WNCU reaches out and asks me to come on. And very timely topic.
Yeah, and I'm very excited that you have said that you would help us for an entire month. And the last time I talked to you, there was so much information that we didn't get around to, that we both decided that it would be really a wonderful opportunity to take some time and delve a little bit deeper into the mental health issue and COVID. So I appreciate that very much. I'm going to ask the first question. Let's talk about how children have to cope with multiple layers of obstacles that are rooted in COVID, such as racism and poverty, discrimination, community violence. Let's talk about some of those things and how young people, before you even get to COVID, have to go through a lot of these obstacles.
Yeah, so let me first set the context, because even before COVID, data showed us that in 2019, there was a 13% increase of adolescents, or actually a 60% increase from 2007 to 2019. A 60% increase. In 2019, 13% of adolescents reported having a major depressive episode. We also began to see an upward tick in emergency room visits for self-harm, so for suicide attempts by adolescents, largely among girls and largely among people between the ages of 10 and 24. And so going into COVID, we were witnessing young people experience mental health conditions. And so during COVID, just like with adults, the pandemic exacerbated some of those mental health conditions like depression, suicidal ideation. And why? One is the isolation that was the leading recommendation or guideline or guidance for responding to the COVID pandemic. So kids could no longer, at the onset of the pandemic, at the beginning of the pandemic, it began to loosen up some in terms of the restrictions as we moved through the pandemic, right? And then now where we are with people being able to be out in public and so forth. But before that, young people, just like adults, had to distance themselves, socially isolate. And so you had young people not hanging out, not going outside, like when we were growing up, hanging out, going to friends' houses, hanging out outside, although teenagers were not doing that either. They were sitting in front of a computer. So that increased, their screen time increased, and their contact with friends and with their social networks decreased. Data have also shown us that there is a correlation between increase of computer time, screen time, and increase in depression, anxiety, and suicidal ideation. So you've got kids who are now resulting to utilizing or using social media as their primary way to social network, to engage with their peers, and also as a primary source of getting information. So Kimberly, what does this do? Well, we know as adults that there's a lot of misinformation and a lot of bad information that's circulating through social media. And although we can't blame it all on social media, but it has played a large part in it. So kids appraising their self-esteem is derived from their contact with people on social media and the messages that they're getting from social media. So if I'm seeing trending, let's just use this as an example, on Instagram, pictures of beautiful girls and popular guys who seem to be doing and living life to the funnest and fullest. And I don't see that, I'm not experiencing that, then I'm more likely to experience a mental health condition such as depression, anxiety, as a result of feeling bad about myself, comparing myself to what I see on the internet and social media, comparing my lifestyle as a teen to what I'm reading about and seeing on social media. So during COVID, it was the worst setup for kids. One, they couldn't, we can see someone and we can say, oh yeah, that's makeup, that's filtered, that's, yeah, whatever, or I'm good, I'm at an age where I feel good in my skin and so forth. Young people don't generally use those same kinds of appraisal tools, self-appraisal tools. They kind of think, they really do believe that, the young girl that's living her best life based, and it's all relative, is really how everybody else except them is living. And so so that's one way in which COVID impacted. And then on the other hand, you also mentioned about experiencing, especially Black kids and Hispanic kids, and we talked about this a little bit before about the disparities. So Black kids were in families where death rates were high in the Black community. And yes. So having to deal with death and grief and not having appropriate access to mental health counselors or grief counselors is another compounding effect. And then you also have where kids were dealing already, like I said, with pre-existing mental health conditions, social determinants and drivers issues. Kids got to, when they could go away and go to school outside of their homes, kids who were living in very difficult home settings had a reprieve. They had a break, right? And that was while they were at school. The ones, once school became online and virtual and kids were stuck in those environments, that also exacerbated feelings of mental health conditions, feelings of depression, anxiety, suicidal ideations, low self-worth, low self-esteem, hopelessness, sadness, loneliness. These are things that we see kids, even though, people say, well, they're on social media all the time, they're on their phone. That does not equate to feeling connected. And so there's this disconnection also that kids may feel.
So, can you talk about families where maybe family members have lost their jobs and they've had economic setbacks in families, and how does that weigh on the children's mental health?
Yeah, it weighs, and I'm glad you asked that question, because it, just like it impacts the adults who are the primary care providers and responsible heads of households, and they're responsible for making sure that food is on the table, a roof is on the head, over the heads of the family members, and clothes are on backs, right? Kids feel that. Kids feel the tension, the anxiety, the depression, no matter how much adults try to hide it. Kids can feel that. Kids can sense when there's been a shift, right? Of in the home, when the parent or the care provider is more angry or angrier than they usually are. They're not as jovial. They are more lethargic. They don't have the energy or the desire. The energy level has dropped. Kids feel that. And so what happens is if families have not created a situation or the norm where families sit down and talk about, and that's what I would recommend, is that you sit down with your kids and you share with them on a kid's level, right, what is happening. I lost my job. What this means is I'm not feeling very good right now, and I am feeling a little sad. But I don't want you to worry about that because I'm getting help or everything is going to be okay. What you don't want is not to have that conversation and kids sense that and they see that and they don't know how to process that, because then they become sad. Then they can become depressed and not understanding what is happening, and they can become fearful about the future. And when they become fearful about the future or hopeless about the future, then that's when we also see suicidal ideation began to be the response again, because kids don't have the same kind of tools and resources that we have as adults to process changes in lifestyles, to process difficulties and challenges that we face. So families should sit down and have these conversations with kids. And they also should limit screen time. They should limit screen time because when you add what is happening in the family, the negative experiences that the adults may be going through or that the family may be going through, increase in poverty or not having money, not having food, lights being turned off, and kids are sitting in that, and they're sitting in that all day, they can turn to the internet as their source of escape, as a way to escape. And we know all the bad things, they can turn to social media as a way to escape. And so then you add on top of that everything that I talked about before, then they start consuming a lot of bad information, and they also began to respond to messaging that is not healthy.
So I want you to talk about then too, not like after the pandemic has lifted somewhat and children are back in school, they're back in school a lot without masks. So what kind of role do public schools play in helping young people to cope after COVID-19?
One, I am a strong proponent of making sure that you have mental health experts, whether it's licensed clinical social workers in schools, all across, in every school. Every school should have a mental health professional, and the ratio to children should be such that the mental health professionals that are there can meet the needs of the kids that are there. It shouldn't be one licensed clinical social worker for 1,500 kids, right? Because the chances of Johnny, who's really dealing with the mental health problem, getting seen in time is decreased based on that high mental health professional and student ratio. So we've got to support our North Carolina has a wonderful and very active and engaged social workers, Association of Social Workers here in North Carolina. We have licensed clinical therapists, mental health professionals. So that's one way. So schools need to make sure that they have, and if they don't, they need to challenge the General Assembly and local government officials that are responsible for funding school services and programs to make sure that their schools and programs have them, because mental health needs is, I think, the primary need that we need to be shifting resources to or adding resources to. We don't need to take them from something else, because COVID as a medical condition is still problematic for us. But we need to be adding additional resources to support and build up school-based mental health services. And that's one thing schools can do. They can also, all teachers can take mental health first aid training and learn about what the signs are to detect kids that are coming in with mental health problems or conditions. And it doesn't have to necessarily be mental health first aid for all teachers, but they could take courses from NAMI. They could learn about, and principals leading the way, about what the signs are when kids are exhibiting or presenting mental health challenges, whether that's depression, and it's before they go into full-blown psychosis, right? So we know what people in full-blown psychosis look like. We used to use that very awful term, oh, they acting crazy now, right? We don't use that anymore, right? Or they cray, right? And I tell people, don't play with that cavalierly, because it's a negative and derogatory term for people who are in psychosis. And so learning the language, so that you're not exacerbating the problem with kids, and that you're not stigmatizing. So making sure that there are mental health services and supports. And then, if in the very least, making sure that you have a list of resources that you can refer families to. You can say, hey, my school, we don't have it. We don't have the funding, but here's a list of resources that I want to connect you and have them help them navigate that process. And then finally, I hear teachers say, you know, I signed up to be a teacher. I didn't sign up to be a social worker. I didn't sign up to be a mental health counselor. Well, the bottom line is, you're going to have to figure out how to do both if you want to teach in today's public schools. You just are, because many kids coming in back to school, returning back to school, are returning with some form of a mental health condition or need. And so you don't have to deliver the service, but you do at least have to be educated and informed enough where you can connect children to the appropriate service.
And on that note, we're going to have to close today. This has been very informative as always.
Thank you.
Michelle Cotton Laws is Chief Experience Officer for the North Carolina Medical Society. Thank you again, Doctor, for your precious time to spend with us today.
It's been a pleasure always. And I look forward to the next conversation during the month that's coming up, May, Mental Health Awareness Month. So
yes, and that'll be next week. So audience, we want to thank you for watching via YouTube and Facebook and Instagram, as well as listening on WNCU 90.7 FM. Be sure to follow us. We want you to subscribe to our pages and see our archive shows. I'm Kimberley Pierce Cartwright, your host for COVID Conversations here on WNCU. Thank you again for tuning in.